What is psychology? At its core, psychology is the scientific study of the mind and behavior. Psychology uses the scientific method to study human thoughts, feelings, and actions. This involves making observations, forming theories, making predictions, and gathering evidence. Psychology explores both conscious and unconscious phenomena. Conscious experiences include our thoughts, feelings, and perceptions, things we're aware of. Unconscious processes include dreams, hidden motivations, and automatic behaviors that influence us without our awareness. The brain is central to psychology as it is the physical organ responsible for our mental processes. Psychology is a broad discipline encompassing many subfields. These include clinical psychology, social psychology, sports psychology, and many others. Psychology has many practical applications. One example is cognitive behavioral therapy, which helps people challenge negative thoughts and change harmful behaviors. Psychologists also conduct research in controlled settings to better understand human behavior and mental processes. Psychology has a rich history, evolving significantly since its formal establishment as a discipline in the late 19th century. In summary, psychology is the scientific study of mind and behavior. It examines both conscious and unconscious phenomena, uses rigorous research methods, encompasses many specialized fields, and has numerous practical applications. Psychology encompasses several distinct areas, each offering a unique perspective on human behavior and mental processes. Biological psychology focuses on the relationship between behavior and the brain, nervous system, and other physiological processes. Researchers in this field study how the brain's structure and function influence behavior, emotions, and mental processes. Cognitive psychology examines internal mental processes like thinking, perception, memory, attention, language, problem solving, and learning. This field explores how humans process, store, and use information, providing insights into how we understand and interact with the world around us. Developmental psychology studies how people grow and change throughout the lifespan, from prenatal development through late adulthood. This area examines physical, cognitive, social, and emotional development, helping us understand how nature and nurture influence human development. Social psychology explores how individuals' thoughts, feelings, and behaviors are influenced by the actual, imagined, or implied presence of others. It examines topics like group behavior, social influence, attitudes, prejudice, and interpersonal relationships. Clinical psychology focuses on the assessment, diagnosis, treatment, and prevention of mental disorders and psychological distress. Clinical psychologists work with individuals across the lifespan who experience psychological difficulties, using evidence-based therapies to improve well-being. Each area in psychology provides a unique lens for understanding human behavior and mental processes, often working together to form a comprehensive picture of the human experience. While we've explored 5 major areas, psychology continues to evolve, with many specialized fields emerging to address specific aspects of human behavior and mental functioning. Classical and operant conditioning are 2 fundamental learning theories in psychology. Both explain how organisms learn from experience, but through different mechanisms. Classical conditioning was demonstrated by Ivan Pavlov's famous experiments with dogs. In this type of learning, a neutral stimulus becomes a conditioned stimulus when it's repeatedly paired with an unconditioned stimulus. As shown in the diagram, the dog learns to associate the bell with food, eventually salivating at just the sound of the bell. Classical conditioning is a form of associative learning. This occurs when 2 stimuli are paired together so that one stimulus becomes associated with the events and situations of another stimulus. For example, companies use celebrity endorsements, so consumers associate their positive feelings about the celebrity with the advertised products. Operant conditioning was introduced by B.F. Skinner, who demonstrated that behavior is controlled by its consequences. Skinner used a device called the Skinner box. When the rat presses the lever, it receives food, increasing the likelihood that the rat will repeat this behavior. Operant conditioning involves reinforcement and punishment. Reinforcement increases behavior, while punishment decreases it. Each can be positive, meaning something is added, or negative, meaning something is removed. For example, positive reinforcement is receiving praise for good work. Negative reinforcement is taking medicine to remove pain. Positive punishment is getting a speeding ticket, and negative punishment is losing privileges for misbehavior. Let's compare classical and operant conditioning. While classical conditioning involves associating events that occur before behavior, operant conditioning focuses on consequences that occur after behavior. Both classical and operant conditioning have important applications in behavioral therapy. Systematic desensitization uses classical conditioning to treat phobias by gradually exposing patients to feared stimuli while they are relaxed. Aversion therapy creates negative associations with unhealthy behaviors. These principles explain how we learn many of our behaviors, preferences, and emotional responses in everyday life. Mental health has become a central focus in modern psychology, with an increasing awareness of its importance. This growing emphasis is reflected in both educational programs and psychological practice, where mental health topics are receiving greater attention. We're also seeing a significant shift toward preventive approaches rather than just treatment after problems arise. Mental health is now recognized as essential to overall well-being, not just the absence of mental illness. Psychologists are increasingly advocating for meaningful changes in mental health care systems. These advocacy efforts focus on securing increased funding for mental health research and services. There's also a strong push for more affordable and accessible mental health services for all populations. Another key goal is better integration of mental health services with primary health care to provide more comprehensive treatment. There's a notable shift toward public health approaches in psychological science. This approach considers mental health at population levels, focusing on prevention and early intervention rather than just individual treatment. This public health framework offers several key benefits to mental health care. It can reach significantly more people through community-level interventions. Public health approaches also address root causes of mental health issues, including social determinants like poverty, education, and access to resources. And importantly, these approaches tend to be more cost-effective in the long term by preventing issues before they require intensive treatment. Looking ahead, the focus on mental health in psychology continues to evolve in several key directions. We're seeing greater integration of digital tools and technologies to expand access to mental health resources. There's also an expansion of peer support models, recognizing the value of lived experience in mental health care. And mental health initiatives are increasingly being implemented in workplaces and schools, bringing support to where people spend most of their time. This growing focus on mental health represents one of the most significant and positive shifts in the field of psychology in recent decades. Technology is transforming psychological practices and research in unprecedented ways. Virtual reality is revolutionizing psychology treatment and research. VR applications include exposure therapy for phobias, PTSD treatment, social skills training, and creating controlled environments for psychological research. Artificial intelligence is being integrated into psychological assessments, enhancing both accuracy and efficiency. AI applications include automated test scoring, pattern recognition in behavioral data, predictive analytics for treatment outcomes, and natural language processing for therapy interactions. Digital behavior plans exemplify how technology streamlines psychological monitoring and intervention tracking. Gamification is transforming psychological interventions by incorporating game design elements to increase engagement and motivation. Interactive therapy apps integrate progress tracking, rewards, and achievement systems to make therapeutic exercises more engaging. Gamified approaches offer several benefits, including increased engagement, better treatment adherence, real-time progress tracking, and personalized intervention pathways. Cyberpsychology is a rapidly growing field that studies the psychological impact of technology and online interactions on human behavior and mental health. This field examines online identity formation, social media's effects on mental health, digital addiction patterns, and virtual community dynamics. The integration of technology and psychology also presents challenges related to data privacy, digital accessibility, and maintaining human connection in therapeutic relationships. Cultural competence has become a cornerstone of modern psychology. It refers to the ability to understand, appreciate, and interact effectively with people from cultures or belief systems different from one's own. This skill is particularly important in therapeutic settings, where practitioners must connect with clients from diverse backgrounds. Psychology education has evolved to place greater emphasis on cultural competence. Course materials now explore how the concept emerged and its profound influence on psychological theory and practice. This includes specialized course offerings, integration across the curriculum, and evidence-based practices for working with diverse populations. Psychologists have developed specialized research methods to study cultural diversity effectively. These methods include personality tests, projective methods, questionnaires, interviews, and sociometric techniques that are designed to be culturally appropriate. Culturally sensitive research ensures that findings are applicable across diverse populations, biases are minimized, and results are interpreted in appropriate cultural contexts. Understanding diverse client perspectives is crucial for effective psychological practice. Different cultural backgrounds shape how people perceive mental health, communicate their experiences, and approach healing. There is growing recognition of the importance of representation within the field of psychology itself. This includes increasing diversity among practitioners, more inclusive research samples, expanded cultural frameworks, and recognition of indigenous knowledge systems. Psychological assessment must also reflect cultural competence principles. This flowchart shows how psychological assessment is approached, with both measurement and non-measurement techniques. Culturally competent assessment requires that tests be validated across populations, interpretations consider cultural context, and multiple approaches be used whenever possible. Ethical considerations are paramount in psychological research and practice. They provide foundational guidelines that protect the rights and well-being of participants. Psychology is built upon 4 core ethical principles: respect, competence, integrity, and responsibility. These principles guide all aspects of psychological work. Informed consent is a critical ethical requirement. This means participants must fully understand what they're agreeing to before participating in research. Researchers must provide details in clear language, ensuring participants know their rights, including the right to withdraw at any time without penalty. Confidentiality and privacy are essential in psychological practice. Psychologists must protect participant identities and secure all data. This includes secure storage of sensitive information. However, there are limits to confidentiality, such as when there's risk of harm to self or others, or when required by court order. Psychologists often face complex ethical dilemmas. A structured ethical decision-making process helps navigate these challenges. This involves identifying the ethical issue, considering relevant principles, consulting with colleagues, and documenting the decision-making process throughout. Ultimately, ethical considerations ensure that psychological research and practice protect human dignity while advancing scientific knowledge. Notable case studies in psychology have significantly shaped our understanding of the human mind. Case studies provide valuable insights through in-depth examination of individual experiences. These historical cases have helped establish fundamental principles that continue to influence psychological research and practice today. One of the most famous case studies in psychology is that of Phineas Gage from 1848. Gage was a railroad worker who survived an accident where an iron rod pierced through his skull and brain, entering below his left cheekbone and exiting through the top of his head. After the accident, those who knew him said he was no longer Gage. He exhibited dramatic personality changes, becoming irritable, impatient, and unable to hold down his previous job. This case provided groundbreaking evidence of the prefrontal cortex's role in personality and decision-making. Gage's case is considered the first to establish a clear link between specific brain regions and particular behaviors and personality traits. Another influential case is that of Henry Molaison, known as HM in scientific literature, from 1953. Molaison underwent experimental brain surgery to treat his severe epilepsy. The surgeon removed significant portions of his medial temporal lobe, including his hippocampus. After the surgery, HM developed profound anterograde amnesia. He could no longer form new declarative memories, while his procedural memory remained intact. His case provided critical evidence that the hippocampus is essential for converting short-term memories into long-term memories. Remarkably, HM could learn new motor skills and improve at tasks over time, despite having no recollection of ever practicing them. Molaison was studied by researchers for over 50 years until his death in 2008, making his case one of the most important in the history of neuroscience. The case of Anna O., whose real name was Bertha Pappenheim, dates back to the 1880s. Anna was a patient of Josef Breuer who experienced various psychological symptoms, including paralysis, hallucinations, and amnesia after caring for her dying father. During her treatment, Breuer discovered that when Anna talked freely about her traumatic experiences and emotions, her symptoms improved. She called this process the talking cure. Her case demonstrated a connection between unconscious psychological processes and physical symptoms. Breuer shared Anna's case with Sigmund Freud, significantly influencing Freud's development of psychoanalytic theory and methods. The therapeutic approach developed through Anna O.'s treatment laid the foundation for modern talk therapy and psychodynamic approaches. Case studies like these have had a profound impact on the field of psychology. They provided the foundation for major psychological theories and established important connections between brain function and behavior. These individual cases led to the development of new therapeutic approaches and advanced our understanding of memory, personality, and psychological treatment. While these historical cases had methodological limitations, they continue to influence psychological research and practice to this day.